Welcome to Improving the Quality Measures % of Long-Stay Residents with a Urinary Tract Infection. This webinar is part of a series intended to help nursing homes understand and improve the 13 long-stay measures that are used to calculate the Quality Measure Composite Score. This measure reports the percentage of long-stay residents who currently have or had a urinary tract infection within the past 30 days. The numerator for this measure is the number of long-stay residents with a selected target assessment that indicates a urinary tract infection within the last 30 days. So I-2300 would be checked. The denominator for this measure includes all long-stay residents with the selected target assessment except those with exclusions. There are two exclusions for this quality measure. The first exclusion is that the target assessment is an admission assessment or a PPS 5-day assessment. So A0310A would be coded as 01 or A0310B would be coded as 01. The second exclusion for this measure is that the urinary tract infection value is missing. So I-2300 would be coded with a dash. So how can improvements be made? First, assure that urinary tract infections are being defined according to standardized criteria. Use the McGeer or Loeb criteria as a guideline. Further explanation can be found at this website. The Loeb and McGeer criteria define symptoms for when an antibiotic should be considered. Symptoms of fever and new pain are included. The criteria also indicates that foul-smelling, cloudy, or dark urine are not considered as signs of an infection. To prevent catheter-associated UTIs, refer to the CDC Catheter-Associated UTI or CAUTI Toolkit. The link is on this slide. Included on this slide are key strategies shared in the toolkit. When working on improving this measure, be sure to refer to evidence-based practices and resources. To prevent non-catheter-associated urinary tract infections, follow evidence-based guidelines to obtain a UA/UC, avoid indwelling catheter use unless appropriately indicated, and encourage fluid intake unless contraindicated. To help prevent UTIs from occurring, assure staff are using criteria consistently. For all residents, assure good pericare and catheter care, encourage adequate hydration, and review medications. Also develop protocols for notifying physicians when there is a change in resident condition. Analyze your findings, and for each resident with a UTI, document a description of what's occurring, the causes and contributing factors for the UTI, as well as the factors that put the resident at risk for UTI. This information should then be used in the development and implementation of an individualized plan of care for each resident, which should decrease their risk for a UTI and thus improve this quality measure. Implementing quality improvement in your nursing home works best if your home has a culture of quality that supports quality improvement. Please refer to the CMS National Nursing Home Quality Care Collaborative Change Package that offers strategies that your team can implement to develop and enhance your quality culture. One of the strategies of high-performing nursing homes found in the Change Package is to provide exceptional, compassionate clinical care that treats the whole person. Striving to prevent problems such as UTIs and treat when necessary is a great example of this strategy. Please refer to the link on this slide to find other proven strategies to improve the quality culture within your nursing home. Refer to the MDS 3.0 RA Manual and the MDS 3.0 Quality Measure User's Manual for more information about the quality measures. To clarify questions about the MDS and/or the quality measures, contact your state RAI coordinator. For further information about the quality measures or about the Nursing Home Quality Care Collaborative, please contact your State Lake Superior Quality Innovation Network lead listed on this slide. And be sure to check out our short videos on each of the 13 quality measures that make up the quality score. Viewing the videos for each of the measures will help your team understand how each measure is calculated and will offer suggestions on first steps to improve each quality measure. Thank you.